Hi everyone, today our group want to share you our own views on how to be a good hemodialysis nurse. Before we start, let me introduce our group to you. There are 4 members in group 1, Yvonne, Catherine, Nora, and Cassie. As we all know, the professional requirements for the hemodialysis nurse are very high. To become a hemodialysis nurse, you must be able to handle the patients with acute or chronic kidney disease. So there is our question, how to be a good hemodialysis nurse. Hi, this is Yvonne. I would like to share my views for this question. First, I realized that in addition to the standard nursing care, we also need a certain degree of nursing intervention for this kind of patients, such as education, cognition, behavior, or diet. We can intervene by video or verbally. For patients with kidney disease, the characters of this disease will lead to the poor compliance, and the poor compliance will also lead to a greater reduction in the treatment effect. To become a good hemodialysis nurse, it's very important to take nursing interventions to improve the patient's compliance. Second, becoming a good hemodialysis nurse requires a strong knowledge system and keen observation and monitoring capabilities. When facing emergencies, nurses can respond in a timely manner, even before the patients have discomfort or complications. The problems can be discovered and solved in time. This is the ability that I think hemodialysis nurse must have. Finally, psychological care. Why do I think the psychological care is especially important for the patients undergoing hemodialysis? This is because the physical condition and the quality of life of the patients have been reduced due to the disease. The patients may be disappointed with themselves and have negative emotions. If this kind of negative emotions cannot be resolved in time, it will have further infection on the mental health and the physical health of the patient. So it's very important to provide the psychological care to the patients. In a conclusion, if you want to be a good hemodialysis nurse, in addition to the standard nursing care, you must provide nursing interventions to the patients to improve their compliance, and you should learn more to have a strong knowledge system, and you can have a keen observation and monitoring capabilities. And you also need to pay more attention to the psychological care.
Hi everyone, I'm Catherine. In my opinion, hemodialysis department is a special department facing special patients, so nurses are also given a special mission, that is to make life closer to life. There are 4 things I want to say about how to be a good hemodialysis nurse. First of all, as a nurse in the department of hemodialysis, the most important thing is to have a sense of compassion. All men are created equal. They suffer from suffering, so someone even give up treatment or their lives. So we need to help them build up the confidence to fight the disease, and we have to understand each other. Second, of course, we need to keep an eye on each patient. Look at their vital signs and see if there is oozing blood at the puncture. Make sure that the dialysis tubes are running smoothly, and keep asking them if they are feeling sick. We also have to teach them about self-care. Thirdly, we need to make a high sense of responsibility. For hemodialysis patients, if we make small mistakes in operation, such as a clip not clamped properly, it may lead to very serious consequences. You also have to be very careful when using drugs. Everything we do is to protect the lives of patients and facilitate their recovery. Finally, skilled operation technology is our guarantee to help patients overcome the disease. In the hemodialysis department, we operate in contact with the patient's blood and must strictly follow aseptic techniques. If the aseptic technique is not strict, it will cause many complications, bring unnecessary sufferings to the patients, and even endanger their lives. Okay, in short, as a hemodialysis nurse, we must be strict with ourselves to ensure the safety of patients.
Hello everyone, I'm Cassie. This is my turn to share my opinion. For this topic, how to be a good hemodialysis nurse. To become a good hemodialysis nurse, I think we should discuss from 4 aspects: nurses themselves, nurses with patients, nurses with doctors, and nurses with hemodialysis room. Firstly, nurses themselves. To become a good hemodialysis nurse, the nurse should have rich knowledge of hemodialysis and master the operation skills of hemodialysis. A good hemodialysis nurse should have an enthusiastic and optimistic attitude towards life and be the cohesion of the department. Nurses should actively participate in professional lectures on hemodialysis to improve their professional knowledge. Secondly, nurse with patient. A good hemodialysis nurse should implement patient-centered care and establish a good nurse-patient relationship. Nurse should closely observe the patient's condition during hemodialysis to monitor abnormal conditions to prevent complication. The nurse should communicate effectively with the patient about the role of hemodialysis and the importance of protecting vascular access. Nurse should always educate patients about their health and tell them to optimize their diet and change their lifestyle. Nurses should patiently explain patient confusion, improve patient satisfaction, and provide quality care. Thirdly, nurse with doctors. A good hemodialysis nurse should establish a good doctor-nurse relationship. The nurse should timely communicate with the doctor and the patient's condition and about the patient's condition and discuss with the doctor the treatment plan for the patient's hemodialysis. The nurse should judge the nursing measure of the patient in time to cooperate with doctor's treatment. Nurse and doctors should cooperate and support each other to better serve patients. Finally, nurse with hemodialysis room. A good hemodialysis nurse should also manage the hemodialysis room well. Nurse should arrange the dialysis room items and strictly implement the dialysis room disinfection system. Nurse should pay attention to the ventilation of the dialysis room to create a good dialysis room environment. Okay, so I think if we can do well in these 4 aspects, I think we have the hope to be a good hemodialysis nurse. Okay, that's all. Thank you.
Hello everyone, this is Hu Chuanning. Today I want to share with you what I think it takes to be a good hemodialysis nurse. I think a good hemodialysis nurse should be excellent in 4 aspects: for patients, for professionals, for colleagues, and for yourself. A hemodialysis nurse should be fully responsible to the patients. This includes providing complete and ongoing care to patients. Observe the patient's condition. For example, whether edema decreases after dialysis, and develop personalized care for the patient. Like APCD can be given to the patient. If edema does not decrease, ensure improper procedures and prevent complications after dialysis. Be patient-centered and hope patient will happy because your care and support. We've all taken the Nightingale Oath at the end of our college careers. If you devote self in nursing, you should devote all your power to caring for patients. Love and pride in nursing are the driving force for a nurse to move forward. The complete nursing process needs the cooperation of the team. Good colleague relationship can improve work quality. And better care for patients, you can learn from experienced hemodialysis nurses and discuss with each other about new nursing knowledge and techniques to improve your abilities. If you want to be a good hemodialysis nurse, you need to be strict with yourself, because any mistakes in dialysis will have a huge impact on the patient. So we should always have a sense to crisis. Continuous learning, continuous practice come to complete the patient's dialysis every time. I think both are the requirements of being an excellent hemodialysis nurse. These are the qualities we think are necessary to be dialysis nurse. We hope this can help you. Welcome to have relevant discussion with us. And thanks for your watching.